Please welcome Del Bigtree and Aaron Siri.
All right. Well, what we thought we'd do, because the last year I was here and earlier today, we've talked a lot about the COVID vaccines and the issues that are becoming apparent to everybody. But one of the big questions really is, what about the other vaccines? What about the other vaccines we've been giving our children? We recognize that the COVID vaccine wasn't tested very long. It was kind of raced out and it didn't end up being effective, but that's an anomaly, right? Well, the truth is the reason my nonprofit has done so well throughout COVID, and we saw an explosion in my weekly talk show going from hundreds of thousands of viewers to millions of viewers, was because we'd been on this investigation for about 5 years prior to COVID. We knew how the whole game was played. We knew what was going on with the vaccine program. So all COVID was a rehash of how all of these vaccines have been approved. You just finally watched how the sausage was made with your own eyes. So those of you that are maybe asking questions, maybe have relatives asking questions, or you're hearing about the huge debate happening around, is Robert Kennedy Jr. telling the truth or not, we thought we would give you some of the evidence that we've collected in our work. And so to get this started, really, my nonprofit, Informed Consent Action Network, I started after I'd been on tour for a year with a documentary about autism and vaccines. And that was one of the most controversial documentaries ever made. We got kicked out of Tribeca Film Festival. But when I wanted to do a deeper investigation, I wanted to know more than just the issues with an MMR vaccine. What about all of the rest of them? One of the issues you have when you're trying to look at vaccines as a journalist and investigate it is you've got this liability protection. In 1986, they took away all liability from manufacturers. Basically, the pharmaceutical industry blackmailed Ronald Reagan, said, we are losing so much money from death and injury cases in courtrooms, we cannot make a profit in our vaccine program, so either you protect us from liability or we're going to stop making them. And so you can't sue the manufacturer. It says right here, no person may bring a civil action against the vaccine administrator or manufacturer for damages arising from a vaccine-related injury or death. Total and complete protection. And I say that to friends and they say, that's amazing. Doesn't that mean right there they must be admitting that there's injury? Of course they are. There's no such thing as a pharmaceutical product that doesn't injure somebody. There's a reason why you have multiple versions of drugs, because if one is giving you side effects, try another one. Vaccines are no different. They have all the same types of elements. I wanted to get into this, and so we wanted to investigate it. Well, what happens? What happens when you take a product, one of the only ones in America, made by arguably one of the most corrupted industries? When you look at pharma, who's paid out more money for death and injury? Billions and billions of dollars by Merck and Sanofi-Aventis and Pfizer for having lied about the safety of their products. But they have one group of products that they cannot be sued for. Well, that created a gold rush, and ultimately what happened to this is in 1986, there's about 3 vaccines given in multiple doses. So for all of you out there that are saying, I'm just vaccinating my kids the same way I was vaccinated, no, you're not. You got maybe 10 vaccines by the time you were 18 years old. When we took liability away in 1986, this is what happened to our vaccine program. Suddenly it explodes. 72 vaccines your kids are getting or your grandkids are getting by the time they're 18. And none of these need to be tested for safety. Why? Why would you? Let's be honest. Why would you spend money testing a product for safety if you cannot be sued if it kills or injures anybody? You wouldn't do it. Why waste the money? It ends up being the perfect product. This is a product that we don't have to test for safety, and we don't even have to advertise it because the government's going to force it on every child in America. This is why this product became one of the #1 biggest sellers, biggest gold rush money-making parts of the industry we now look at as the giant big pharma. So I went to Aaron Siri and said, look, they have total liability protection. What do we do? And we started discussing, what if we sue the government? Since the government's taking on the liability, they're saying to the manufacturers, we'll handle this. So now you sue the government. Imagine this. When you're injured by a vaccine, you have to sue Health and Human Services. In fact, the head of Health and Human Services is who is you're naming as a defendant. So now the government's going to use Department of Justice lawyers against you and tell you you're crazy, you're wrong, that injury didn't happen. You have to prove that it happened. That's how the court system works. And who was supposed to do the safety trials that you need to use in court so that you can prove this injury is caused by the vaccine? Health and Human Services.
So in terms of the clinical trials, I think that this chart might help bring home the impact that taking away liability for manufacturers of vaccines has had on how the clinical trials relied upon to license those products were conducted. This is a list of the vaccines administered to babies 3 times each by the time they're 6 months old.
I mean, think about this. I want you to think about the placebo-controlled trial. This is something that's really starting to make the news, and they're saying we have done these placebo-controlled trials. They haven't. And why is it important? When you're testing a drug, one group gets this testing drug, the brand new drug, another group gets what's a placebo, something that has no effect on the human body, but we don't know who got what. It's double blind. They both get it. In the case of the drugs, 6 years, 7 years, 5 years, at least 2 years, we track both groups all the way through and ask obvious questions. Who had more diabetes or autoimmune issues or cancers or mutagenic effects? And obviously, at the end of it, you unblind it. The scientists find out who was who because they shouldn't be manipulating it. And then you see, was the safety profile the same? Did the group that get the saline injection or got the sugar pill have the same amount of health issues as the ones that got the product? So in the vaccines, there are no placebos. This is the only way to prove causation. When they say to you, well, we've never proved causation of this injury, whether it's multiple sclerosis in vaccines or autism in vaccines, we don't have any evidence. There's no causal relationship because you never did the trial, which would be the only way to prove causation, which is a placebo-based trial. You skipped it. And this is what they're doing on all these vaccines.
And Pfizer wants to know the safety profile of their drugs before it goes on the market. Why? What happens if the drug causes injury? They can be sued, and they're sued all day long on their drug products. Drugs come off the market all the time, but they can't be sued for the vaccine.
Let's show you some evidence. There's a hepatitis B vaccine given to a baby in the first day of life. First 24 hours, they're getting this vaccine. We're not making this up. If you look at the vaccine, if you asked your doctor, I want to see the insert wrapped around the vaccine, look what it says about the safety trial. This is how we licensed it. This is what the FDA saw and said, good enough for us, put it on the market. In 3 clinical studies, there was 434 doses of Recombavax HB that were 5 micrograms, were administered to 147 healthy infants and children up to 10 years of age. 147 was the size of this massively tested trial for the fate of every day one old baby in America and probably around the world. How long did that trial last? No placebo. They were monitored for 5 days. 5 days.
And to put what you're looking at in context, just to understand, this is the FDA website. This is the package insert for the hepatitis B vaccine. Section 6.1. You can look at every single, don't take our word for this chart on the right. Those safety review periods seem incredible. And in fact, I wouldn't believe them if you showed them to me. But all you have to do...
Would you take any drug that had 5 days, 3 days, 28-day safety trial? That would be insane. And by the way, we've brought lawsuits against CDC and FDA on this. We said, if there's a safety trial longer than 7 days on the hepatitis B vaccine, we'd like to see it. FOIA request, right?
Right. So for all of these clinical trials, in Section 6.1, they summarize the safety review period, the control used, and how big the trial is, how powered it is. And those numbers seem so unbelievable that we actually FOIA'd, Freedom of Information Act, sent requests to the FDA to get copies of the clinical trial reports. And that, in fact, for example, for this hepatitis B vaccine, it is 5 days of safety review after injection with 147 children. That doesn't determine anything. And the only reason I think the company that sells this product, Merck, is okay with this, why the FDA is, we'll get into, is because they don't have to worry about paying for injuries after it's licensed.
Let's get to some videos.
Okay.
We plan on this going faster. I'm like, wow, that clock's moving quickly. I want to show you what some of these people are saying on the stand. So this is Stanley Plotkin,
yep.
Here, right? So Stanley Plotkin is arguably the leading voice in vaccines in the world. He's on almost every vaccine company's board of directors in one way or another across the world. And if you go to the CDC and you sit in one of their meetings at the ACIP, the Advisory Committee on Immunization Practices, the gavel is called the Plotkin gavel. And the book written on vaccines that's this big is Plotkin on Vaccines. When he was asked...
Want to play it?
Yeah, go ahead.
Yeah. And this is just the world's leading vaccinologist in vaccines when I asked him about, and I confronted him about the hepatitis B vaccine that we just looked at, under oath. And when they're under oath, you get a little bit of a different answer than when they're on TV or they're doing a commercial.
Dr. Plotkin, earlier you testified that there are 2 Hep B vaccines on the market, one by Glaxo, GSK, that's Engerix B, and the other one is by Merck, Recombavax HB, right?
Yes.
This is the product, the manufacturer insert for Recombavax HB, correct?
Yes.
And the clinical trial experience would be found in Section 6.1, correct? Correct? Dr. Plotkin?
Yes.
Okay. In Section 6.1, when you look at the clinical trials that were done pre-licensure for Recombavax HB, how long does it say that safety was monitored after each dose?
Let's see. 5 days.
Is 5 days long enough to detect an autoimmune issue that arises after 5 days?
No,
Is 5 days long enough to detect any neurological disorder that arose from the vaccine after 5 days?
no.
There is no control group, correct?
It does not mention any control group, no.
No. If you turn to section 6.2, under immune system disorders, does it say that there were reports of hypersensitive reactions, including anaphylactoid reactions, bronchospasms, and urticaria having been reported within the first few hours after vaccination?
Yes,
Have there been reports of hypersensitivity syndrome?
yes, that's what it states.
Reports of arthritis?
It is mentioned.
Okay. It also reports autoimmune diseases, including systemic lupus, erythematosus, lupus-like syndrome, vasculitis, and polyarteritis nodosa as well, correct?
Yes, that's what it states.
And also it states that under the nervous system disorders, it states that there have been reports of Guillain-Barré syndrome, correct?
Yes.
As well as multiple sclerosis, exacerbation of multiple sclerosis, myelitis, including transverse myelitis, seizure, febrile seizure, peripheral neuropathy, including Bell's palsy, radiculopathy.
Radiculopathy.
Thank you very much. Muscle weakness, hypothesia, and encephalitis, correct?
Correct.
These are events that are reported after vaccination, and as we've just discussed, in order to establish whether it's causal between the vaccine and the condition, you need a randomized, placebo-controlled study. But
Yes.
that was not done for this hepatitis B vaccine before licensure, was it?
No.
Okay. And given that the vaccine now appears on the CDC's recommended list, isn't it true that it would now be considered unethical to conduct such a study today?
It would be, yes, it would be ethically difficult.
And there you have it. That's how every vaccine has made it through the process. Imagine how many of us gave the day one old baby with all of those side effects that were known, but the reason they get away with saying that there's no causal relationship is they refuse to do the study that would have allowed you to say they were causally related, and therefore it gets approved. 5 days of safety. That is the massive amount of studies that have been done for products given to day one old babies. And let me point this out. We have more babies die on the first day of life in the United States of America than every other industrialized nation combined. That is a terrible death rate for the greatest hospital system in the greatest nation in the world. And can they explain it? And why does their baby need a hepatitis B vaccine, a sexually transmitted disease that you usually only get if you were involved in multiple partners, prostitution, or sharing heroin needles? Why does our baby on the first day of life need to get that vaccine? And they might say, well, the mom could be hepatitis B positive. Yeah, but every mother in America is tested and gets a blood test and we know whether she has it or not. So then why is every baby getting it when we know that the only mothers where the baby might even need it? This is how ridiculous this entire system is, and it starts there. Let's continue on. Post-licensure, right? We talked pre-licensure. That's like what happens before it's licensed. What happens after it's out there in the market?
So if, before licensure, you don't have proper clinical trials that review safety for long duration against a control group that you can really compare it against, you'd at least hope that after licensure, that studies are being conducted to assure the safety of childhood vaccines. Well, as we all know, and you've probably heard the CDC and other health agencies say all the time, all claimed harms are thoroughly studied.